大家好. Hi, everyone. Let's continue our Chinese medicine dermatology talk. Today's topic is Alopecia areata. Now, let's go to the slide. What is Alopecia areata? There are a lot of information in the website. Generally, it is a term for hair loss. Alopecia areata is a specific common cause of hair loss that can occur at any age. It usually causes small, corn-sized, round patches of baldness on scalp, although hair elsewhere, such as beard, eyebrows, and eyelashes, body and limb can be affected. Occasionally, it can involve the whole scalp or even whole body plus scalp. It's not possible to predict how much hair will be lost. Regrowth of hair in typical alopecia areata is usually over a period of months or sometimes years, but cannot be guaranteed. The hair sometimes regrows white, at least in the first instance. Further hair loss is not uncommon. In alopecia totalis and alopecia universalis, the likelihood of total regrowth is less. Let's go to the next slide. I have downloaded some photos from website. These are the very typical alopecia areata look. I leave the cause and symptoms and Western medicine treatment for you to do your self-study. During my 20+ years of Chinese medicine practice, I actually have encountered a few alopecia areata. Here's one. This is a 21-year-old girl. She wanted to have her own clothes factory, have her own clothes brand, and she, of course, suffered a lot of stress, and hair loss like this happened. There are more. This is only on right side. Left side has this kind of patches as well. And this is a man over 60 years old. We can see that's the left side hair loss. This is the during the first treatment, this photo. And this is later. I want to show you the hair regrow stage. This is after a few times of treatment, and this is very close to the final stage. That's the right side photo. You can see the hair loss is like this, irregular shaped patches, and hair regrows at first. The light colored hair regrows, and after a while, there were more dark colored hair regrow. And this is the back side of the head. We can see here are the hair loss patches, and here are the regrowed light colored hairs, and here are the later stage of hair regrowth with thickened and darker hair color and hair. Now we put our time more in the Chinese medicine part. In Chinese, we call alopecia areata 油风 or 鬼剃头. The main reason we consider is the wind. But what produces wind? Now let's look at the etiology and the pathogenesis. There are 3 different types. I'll talk about them one by one. It's possible to have more types, but they mainly these three types. If you at the clinic meet other types, you just follow the Chinese medicine diagnose and treatment method, conduct your own treatment. It's easy. The first type is blood heat, giving rise to wind. Normally, stress, emotional factors, or other, say, life events or grief and loss produce the heart fire, blood heat, and then produce wind. Wind moves, causing hair malnourished and cause different kind of a shaped hair loss. The next type is deficiency of yin and blood. Long-term illness cause essence and the blood deficiency and kidney yin deficiency, which produce wind, make hair malnourished, and cause hair loss. We call 血虚生风 in Chinese. The first type we call 热盛生风. And the third type is blood stasis, 血瘀生风. Long-term blood stasis block the meridians, which include the collaterals, which is spread all over the body. New blood is unable to reach and nourish the hair, resulting hair loss. Now we talk about the treatment. In Chinese medicine, we have a few types of treatment. First, we talk about internal treatment. For the first type, blood heat giving rise to wind, the hair loss is sudden and in circular patches. The underlying skin is glossy, normal in color, or slightly pink, and accompanied by slight itching. The hair around can be easily pulled out. This type is more seen in the young people. There's no physical discomfort, but their stress or happiness. The tongue is often red with thin yellow coating. The pulse is very slippery and rapid. There may be restlessness, thirst, yellow urine, and constipation. Our treatment principle is cool blood, extinguish wind, nourish the yin, and protect the hair. The formula we use is this. This formula is not in a particularly formula name, but all the ingredients are here. It is formed following our treatment principle. With the modification, when the person is stressed, irritating, or angry, we can add 远志, 珍珠母, or raw 石决明. 石决明 is the shell of abalone. Raw, normally we use after charcoal or baked, but this is raw without any Chinese medicine treatment preparation, I mean. And now the second type is deficiency of yin and blood. The patient are normally weak, thin after long-term illness or giving birth. Giving birth can lose a lot of blood, can make person have blood deficiency. The tongue is pale with little coating. The pulse is thin, deep, or thin, rapid. The treatment principle is nourish yin, tonify blood, dispel wind, protect hair. The formula we use to modify is 四物汤 and 七宝美然丹. 四物汤 here is tang, D is not a D, it's a G. It's a famous formula for nourishing the blood. It only has 4 ingredients. Now, the formula is here. You can see this in nourishing herbs, blood tonifying herbs, wind expel herbs and hair producing herbs. When we see the patient have weak spleen, you can add 炒白术, 炒麦芽. When the patient has back pain, weak knee, insomnia, which are the typical kidney deficiency symptoms, you can add 杜仲、远志、夜交藤 or 枸杞. It's different from 枸杞子. It's 枸杞. It's a kidney young nourishing herbs. The third type is blood stasis. Patient of this type often experiences headache or a piercing pain of the scalp before hair loss begins. The hair loss is in patches and the body hair may also be involved. It normally takes a long time for hair to regrow. The tan is dark or has purple spots. The pulse is thin and choppy. Treatment principles invigorate the blood, unblock the channels, extinguish wind, and nourish hair. The formula we use to modify is 通窍活血汤. I put all the ingredients here. We can see there's a lot of blood invigorating herbs. Now we talk about the external treatment. The first method, which is very useful method and simple, easily to be applied, very practical. So this, I put it first. We use fresh ginger slices, rubbing the hairless area until there's a sense of warmness. We can do it 3 times daily. We can do more than 3 times daily. If you can't make it 3 times daily, once or twice is better than none. Next time is practitioners will make 白芷 oil for patient. You can use raw herbs, or if you can change it to granules or powder. If you use raw herbs, you follow this method and then make a jar of the oil and then give it to patient to apply by themselves. I leave to yourself. Now it's acupuncture treatment. It's very important. You can see I have used it in my photo. As the normal acupuncture treatment, we often choose local points, distal points. With this, we add one more method is using circling acupoints. For local points, we try to find acupoints because acupoints still achieve much better treatment result than ash point or other non-acupuncture points. We can choose the acupoints on the scalp, 5 to 6 points each time, once every 2 to 3 days. In Australia, it's very hard for patients to come to every 2 to 3 days. We can do twice a week or once a week at least to achieve some result. The 2 to 3 days frequency will bring better result than once a week. Distal points can combine together with local points. Here said once a day, but don't have to. Whenever you do the local points, you can do the distal points together. So patient only come to your clinic once. When we do the distal points, we choose spleen, stomach, kidney, liver, meridian points on the lower legs. So at the same time you do the head acupuncture, you can put few points on the lower legs, which we say one stone hit 2 birds. Encircling acupoints is, you can see from my photos, previous photos, In the hairless area, we insert needles around the hairless at the border. We insert needles in about 15-degree angle, and then put needle in towards to the center. Sometimes the needle top part can be in the hairless area under the skin, and then retain the needles there for 30 minutes, manipulate every 10 minutes, once every 2 days. It is ideal if you can't, as I said before, at least once a week. And other treatment, which is plum blossom needling. In Chinese medicine, we call 梅花针 or 7-star 七星针. What we do is we gently tap the hairless patches with plum blossom needle until the skin is red or slightly bleeding occurs. So there are some tiny little bit bleeding points in the hairless area. And then we tap from the hair loss patch border towards to the center once every 2 days. Like my the over 60 years old male patient, he lives 1.5 hour drive distance from my clinic. Of course, he can't come every day, every 2 days. It's very difficult. So I told him, go to your wife, ask for a comb, hair comb or hair brush. You just tap your own hair, tap the hairless area, tap like this, and then tap like 10 minutes, 15 minutes, as much as you can, 3 times, 4 times, as many times as you can. It's better than nothing. It is always helpful. Sometime when the treatment's limit, we can always use some replace methods to help. Now the moxibustion, we use indirect moxibustion with ginger on the bladder 23, 深柱, which is at the back, bladder 13, 肺腧, it's 烂腧 at the back, stomach 36, TB5, GB34, stomach 36 and GB34, they are very close, they under the knee. We can do it after the back shoe points. And then we do, when we do the back points, we can let the patient put arm up, and then we do the TB5. And then as patient turn around, and we do the stomach 36 and the GB34. You can also put the ginger on the hair loss patches and then put the moxa on the top and do the moxibustion. Treatment, again, should be, ideally, should be 2 to 3 days, every 2 to 3 days. 5 sessions is a course. But if you can't make it, you try your best to make it as frequent as possible. After each course, you have 5 days rest. Now, the last treatment method is counseling. As a practitioner, we actually do a lot of counseling. Myself has a counseling diploma. If you don't have a counseling degree, you can always do it part-time. There's no harm. They only can help you with your profession, with your practice. But if you can't, you can recommend patient to other counselors, psychologists. Now, our talk today stop here. Thank you for listening. I'll see you next time. Thank you. Bye.